Member for Kildonan St. Paul.
Thank you, Madam Speaker. I'd like to hear from the Health Minister regarding the Public Health Agency of Canada spending $1 billion on the funding for border and travel measures and isolation. How much was spent on providing nutritious meals to Canadians?
The Honourable Minister of Health.
She's correct to mention that we have had to look after Canadians both inside the country and when they came back to Canada with all the important health and safety measures we put into place.
The Honourable Member.
Thank you, Madam Speaker. The reason I ask is because we're seeing a lot of significant events happening at quarantine hotels. A celiac woman from Edmonton went 40 hours without food. Does the Minister believe the money was well spent on this nutritious food for those with extreme dietary needs?
The Honourable Minister.
She's correct. No, people who come to these places need to be treated with respect and care, and that's what the Public Health Agency has to do in collaboration with the providers of the service.
The Honourable Member.
Chair, thank you. Can the Minister say how much was spent on providing Canadians with clothing since they didn't have their luggage?
Honourable Minister.
Well, I'm sorry to say that I don't know the exact number. What I do know, however, is that, again, we need to look after all those people that come into Canada and treat them.
Honourable Member.
The reason I ask is because Andrew from Ottawa, he was on the news. He spent 5 days in quarantine, Madam Chair, and he didn't have a change of clothes. He had also 3 negative COVID tests. Is that acceptable?
The Honourable Minister.
Madam Speaker, that's not acceptable. What wouldn't be acceptable either is to follow the proposal of the Conservative MPs. Just a few days ago, they asked for the removal of all test and quarantine measures.
Honourable Member.
Madam Speaker, the Minister is incorrect. The Conservatives have long supported expert advice on our borders. And we also we're interested to see the expert advisory panel of this government saying that the guiding principles of all health decisions should be to minimize unintended harm. Does the Minister feel he's fulfilled that with quarantine hotels?
The Honourable Minister.
That's right, to minimize harm is exactly what we should be doing, and that's what we've done throughout the crisis by putting strict measures at the borders to protect everyone, including those inside Canada.
Madam Chair, I would beg to differ. There's a woman, her name is Dr. Gotterham. She is a physician and a vaccine advocate in Peterborough. She has a wait list of over 1 year for critical medical appointments. She's been stuck in quarantine, and she's having to reschedule so many appointments of patients in critical needs. So does the Minister believe that unintended consequences in this regard aren't important?
The Honourable Minister.
Well, I'm going to smile because she mentioned a vaccine advocate. I think there should be more vaccine advocates on the other side of the House, and let us know how many Conservative MPs have not yet received 1 dose out of the 62 million doses administered to Canadians.
The Honourable Member.
Speaker, Dr. Gotterham is a dermatologist. Skin care and skin cancer diagnosis can't wait. She's very concerned that a number of her patients cannot wait, and yet they're having to because this minister has kept her in a quarantine hotel despite having a negative COVID test for 3 days. So can the minister explain why this is acceptable?
The Honourable Minister.
Et je vais à nouveau le répéter en français cette fois-ci.
I'll repeat myself in French this time. There have been strict border measures at the border since the beginning of the pandemic, and they are to protect the health and safety of all.
How is the minister protecting public safety when he's not allowing a pro-vaccine advocate in her community, an important doctor in her community, to access patients that have been waiting a year?
Honourable Minister.
Madam Speaker, I don't exactly understand what the objective is. If the objective is to suggest that we should not have measures, quarantine and testing procedures at borders, then maybe she should say so.
The Honourable Member.
Madam Speaker, I'll read what the doctor has said herself. And now, again, she's been waiting 3 days. She has a negative COVID test from this government, still waiting 3 days to be released. She said, quote, "I am stuck here despite my negative test. This is inhumane, forcing me against my will, given I am no risk to Canada." So again, why is the doctor being held hostage by this government?
The Honourable Minister.
It is to take no measure whatsoever and to remove all border testing and quarantine. Now, if that's the intent, maybe we should hear that more clearly.
The Honourable Member.
I think our intent is to ensure that Canadians are treated with dignity and respect, Mr. Speaker. Does the minister think he's doing a good job at that?
The Honourable Minister.
Again, Madam Speaker, I haven't heard the answer yet. Is the intent to ask the government to remove all testing and quarantine measures, as has been suggested by this colleague?
My question, Madam Chair, My apologies, Madam Chair, is that the taxpayer spent $1 billion. We know with this government, the sky is the limit with spending. And yet we're seeing an unbelievable amount of mistreatment, Canadians going without food, Canadians going without baby diapers and milk for their babies, celiacs going without food they can safely eat, doctors who are having to put off critical patient appointments. And yet all of these people have had negative tests and are just waiting for a bureaucratic stamp of approval for days. And it's $1 billion, and this is what the Canadian taxpayer has received. I just don't find it acceptable. And the minister himself has said he doesn't believe it's acceptable. I'll ask him again here for the record, does the minister think this is acceptable to treat Canadians this way?
The Honourable Minister?
What would be acceptable, Madam Chair, is to hear the views of the opposition members of Parliament. Do they believe that we should really take away all measures at the frontiers, including quarantine and testing measures?
The Honourable Member?
Does the minister think it's been $1 billion well spent?
The Honourable Minister?
Well, $1 billion spent to protect the health and safety of Canadians, I think it's a good
The
idea.
Honourable Member?
I believe he's been protecting the health and safety of the celiac woman who went 40 hours without food.
The Honourable Minister?
Again, Madam Speaker, we don't know what the alternative is. Are they proposing that we should remove all testing and
The Honourable Member?
Madam Chair, is that the government should be treating Canadians with dignity and respect. If they have a negative COVID test, they should be released from quarantine. Particularly the doctor that hasn't been able to see her patients, particularly the celiac woman who hasn't eaten, particularly the man who hasn't changed his underwear for 5 days, who has a negative COVID test, Madam Chair. That is unacceptable behavior from this government, and I'm not appreciating that there's absolutely no dignity and respect coming from a minister of this government, the health minister, who clearly doesn't care that people have been treated without dignity and respect for days with negative COVID tests.
I do have to allow the Honourable Minister to respond.
Well, I think respect here would be to tell the House clearly what the measure that the member proposes would be.
There's 10 seconds left.
Madam Chair, I very much look forward to the time when Conservatives are in government and I can answer his questions.
The Honourable Minister